Hey, my name is Petra Cruz, and I'm obsessed with all things birth, but especially VBAC. I am a birth doula and mom who had a vaginal birth after 3 cesareans. In this podcast, we dive deep into the inspirational world of vaginal birth after cesarean. In each episode, you'll hear inspiring VBAC stories, practical tips from professionals who've championed the VBAC cause, as well as my personal journey and how it might help you on yours. From mindset shifts to evidence-based practices, you'll leave each episode feeling inspired and informed. Get ready to soak in the wisdom, embrace the strength within, and join this incredible VBAC community. This is the VBAC Junkie Podcast. Hello and welcome back to the podcast. So if you are listening to this in real time, it is April 2024 and it is Cesarean Awareness Month. Okay. So if it is anywhere in April in any year, it is Cesarean Awareness Month. Okay. So what does that mean? What is Cesarean Awareness Month? So obviously we're bringing awareness to cesareans. This is a campaign created by ICAN, which stands for International Cesarean Awareness Network, which focuses on all topics surrounding cesareans, including reducing preventable cesareans, supporting cesarean recovery, and advocating for vaginal birth after cesarean, aka VBAC. So, why do we need awareness? Well, because researchers estimate that almost half of the C-sections performed in the US are done in situations when babies could actually be safely delivered vaginally instead. Now, preventable C-sections may be responsible for up to 20,000 major surgical complications a year, including everything from like sepsis to hemorrhage to organ injury. So obviously, those are some of the risks when you do have a cesarean. So I want to tell you a little bit more about ICAN because ICAN can be so helpful. It was really helpful for me when I was planning my VBAC. So, what it stands for, like I already said, is International Cesarean Awareness Network. Now, this is a nonprofit advocacy and support organization whose mission is to actually improve public health by reducing preventable and traumatic cesareans through education. They support, like I said, cesarean recovery and advocating for vaginal birth after cesarean, aka that VBAC. So their vision is a reduction in the cesarean rate driven by, women giving birth and them assuming responsibility for their healthcare by making evidence-based, risk-appropriate birth decisions. So ICAN is 100% volunteer-led, which is incredible, and operated with more than 100 local chapters and over 200 dedicated leaders. ICAN was founded in 1982 in the United States as the Cesarean Prevention Movement in response to a birth climate that enforced a once a cesarean, always a cesarean. I hate that rule. I hate that saying because I believed it for so very long. But anyways, in the 21st century, the rate of cesarean births in the United States has skyrocketed to 33%. The cesarean rate was actually 5.8% in 1970. So, just in one generation alone, the cesarean rate has skyrocketed by 500%. Think about that. That's wild. So today, obviously, a third of all babies in the US are born via cesarean. And for Black people, the rate is even higher. And it's wild. Depending on where you are, like New York, a Black woman is 10 to 12 times more likely to die in childbirth. And I mean, think about that number. That is crazy. Crazy, crazy, crazy. So there's a lot we could talk about there. And we'll have to get into that in like another episode because there's so much to it. So the WHO, which is the World Health Organization, states that the cesarean rate should be around 10 to 15%. So this is really like a public health concern. And not only that, think about think about your personal being. Like me, I had 3 cesareans and then I had a vaginal birth. And I was forever changed by that vaginal birth, and it wasn't just because I didn't have a cesarean. It was because I learned so much about myself and I was able to like stand up for myself and find my voice. And I want everybody to be able to not just have a vaginal birth if, that's what they want. I want you to be able to feel confident in your decision and be able to make your own decision without feeling guilt or shame or regret, Because the feeling is just like nothing else in this world, especially if you're anything like me, which is a recovering people pleaser. It is so transformative. Now, I'm not here to just like bash on cesareans, okay? When a cesarean is necessary, it can be a life-saving surgery and well worth the risks involved. So, like I'm going back to ICANN. So ICANN recognizes that cesarean care, when appropriate and necessary, can be less traumatic when the surgery is patient-centered. So that could include gentle cesarean options like being awake and alert, having that immediate skin to skin, ensuring appropriate levels of anesthesia, not just drugging mom up to the core, and no crosstalk like those background situations where they're talking about their weekend partying or their dinner they're going to get to in the OR. This can actually improve the quality of cesarean care. But the inappropriate overuse of cesarean surgery is actually jeopardizing lives. In fact, the maternal mortality rate in the US is the highest among developed nations, with Black gestational parents being 3 times more likely to die from childbirth related complications than white people giving birth, which is wild. I mean, why those numbers? Like I said, we could have a whole episode about this, and I will create one. So while I can believe that cesareans do save lives when used appropriately, they recognize that the increase in the number of cesareans has actually not resulted in an increase in healthy women or babies when you consider the impacts that like birth trauma and other things have on families. Having birth trauma from these cesareans sometimes can be worse because you could develop like PTSD. And then depending on, if you have like organ damage from the cesarean, then you're healing from like an added surgery. So, anyways, like I said, the current rates of C-section are 1 in 3. So that means 1 out of every 3 women you see that are pregnant are going to have a cesarean. They're going to have a cesarean. Like, that's so wild. And obviously, like these rates can vary by country, by personal factors, access to healthcare, and like the hospital actual policies regarding vaginal birth and cesarean and all that kind of stuff. The rate of cesarean could be like for the hospital, let's say like 15%. But like in Brazil, the rate of cesarean is like 80%. What? Yeah, in some places, the rate of cesarean is 80%. How wild is that, right? So it definitely depends on where you are geographically, who your practitioner is, if you're considered to be like a rural area, because if it takes you like 2 hours to get to like a hospital or something, are you going to leave if you're like in early labor? No, you might get induced. They might give you Pitocin to speed up your labor. And then, obviously, once you do have certain things introduced into your labor, it can potentially increase your risk for having a cesarean. There are definitely some medical reasons why it could be necessary to have a cesarean. One of them would be placenta issues. So your placenta placement, like if you have a complete previa where it's covering your entire cervix, obviously that could be dangerous. If you have placenta accreta, where your placenta is actually embedded into your uterus, that is a valid reason too. Obviously, if you have a placenta abruption, so like your placenta separates from the uterus too soon, or just, something funky with your placenta where you're like bleeding, hemorrhaging, obviously that is a valid reason. Preeclampsia, because that can increase your risk for so many things. You could have seizures because you're having like high blood pressure and It could damage your kidneys. Like there's so many risks to preeclampsia. And also just like severe maternal issues. Everybody could be so different. Like if you have blood diseases or I know of a person who had a heart condition. So there are very valid reasons, and also like umbilical cord prolapse, say the umbilical cord comes out before the baby does, that could be a cause for a cesarean. But I have also heard of babies being born with a cord prolapse, so we never know. So fetal distress, sometimes the baby is not doing very well. But also that's so nuanced because sometimes we have so much monitoring during your labor that it gives you like a skewed read of the baby, how the baby is doing, because the baby's heart rate, dipping and stuff, that is actually normal during labor. It's only if it's like stays low and doesn't recover, or stays high and doesn't recover, those could be indications that the baby's not doing very well. But you can also get intermittently monitored, so you're not just hooked up to monitors the whole entire labor. Also, your mental health. If your mental health is in question and let's say you are fearing having a vaginal birth and it is actually causing you, like, say, anxiety or overwhelming fear to where you can't function, then sometimes or even if you had a traumatic vaginal birth before, sometimes having a scheduled cesarean is actually a better option for the mom. So there are so many valid reasons to have a cesarean. This is not like a extensive list. And if you feel like a cesarean's right for you, then you go for it, right? Because this is your body. This is your body, okay? I'm nobody to tell you what to do or not to do. I'm just here to give you some information. So I want to also tell you, like, what does ICAN do? ICAN, like I said, International Cesarean Awareness Network. They have worked so hard to encourage evidence-based birth practices and to help educate people about their choices in birth. They always try to share evidence-based information using the latest research that is accessible to consumers and their practitioners. They also offer support and information to people all across the world through social media, through conferences, webinars, email lists, podcasts, and obviously their local chapters. ICANN chapters are the heart of their organization because they have local chapters all across the world that host free support meetings. And like personally, when I reached out to my local ICANN chapter leader, she gave me resources of practitioners that were in the area. And that was super helpful because then I was able to call around and find out who was or was not on board with what I was planning to do. So that was like super helpful. The support meetings that they give options for discussing birth experiences with other people who just get it. Because I feel like if you haven't had like a cesarean, you might not understand completely where we're coming from. There's nothing wrong with that. But finding recommendations for local perinatal healthcare professionals, not even just doctors, but like mental health practitioners and, chiropractic or whatever other like holistic or any recommendations or resources that they might have that, you might not know yet. It's just so very helpful. And ICANN also wants to raise awareness of birth trauma in order to try to facilitate empathy and understanding for people who are coping with the after effects of a traumatic birth, whether it be a traumatic vaginal birth or a traumatic cesarean, because both are very valid. I also wanted to talk to you about your options. So, you do have options after you have a cesarean. Obviously, you can plan for a VBAC, which is a vaginal birth after cesarean, or you can have a repeat cesarean. It's totally up to you. But many people that labor after cesarean will actually go on to have their babies vaginally. Now, of those people who are planning to labor after a cesarean, so they call these people a TOLAC, trial of labor after cesarean. I hate that word. I just want to call them VBAC hopefuls. So 60 to 80% of those people who are planning to labor after a cesarean will actually have a vaginal birth. And when that comes to a home birth, that number is actually higher. It could be anywhere from 85 to 95%. So for most people, VBAC carries lower risks than a repeat cesarean. Obviously, every pregnancy is different, and it's really important to evaluate your unique situation. And you can do that with your partner, you can do that with a healthcare practitioner if that's something, the route that you want to go to discuss to decide with them. Now, obviously, you can seek out other options for figuring out if you're a good candidate. One organization that I've talked about is ACOG. They have specific definitions for defining who is and isn't considered a good candidate, quote unquote, good candidate for a trial of labor after cesarean, aka VBAC hopefuls. They also recommend evaluating individual circumstances. So I always recommend you evaluate your individual circumstances because, of course, you can go by the ACOG definitions, but they don't have definitions for every single situation, and nobody knows your unique situation but you. Like personally, they don't have like information for my VBAC after three cesareans situation. And everybody that I talked to was telling me against doing it. Now, if I would have obviously just followed them blindly, I would not have had my VBAC. I would have probably had a scheduled cesarean. So I definitely always recommend to just do your own research and do what feels good to you, no matter what the recommendation is. I mean, obviously, it depends on what you want to do and what you decide is the best decision for you, period. Now, when discussing a VBAC, obviously you always hear uterine rupture is like the specific risk that is like you hear all the time that is the main concern. So uterine rupture can be life-threatening and serious. However, the risk of uterine rupture occurring is very rare, like we've talked about before, affecting less than 1% of those women laboring with a low transverse incision with like a single cesarean under their belt. And studies show the risk of uterine rupture decreases with each VBAC that you've had. And obviously, many women have given birth to their babies vaginally, even with more than one prior cesarean. A vaginal birth after multiple cesareans for many may be a low risk option compared to having a repeat cesarean. Now, it is so important for you to educate yourself and inform yourself before making the choice to VBAC. You should always, always, always just, look at the risks, look at the benefits, and look at your alternative options. And then be able to decide what feels right to you. Trust that gut feeling that you have. And like I talked about, another option is to have a family-centered cesarean or gentle cesarean. Now, the family-centered cesarean has an overall purpose, like the purpose of it is to try to create like a peaceful, calm atmosphere that closely mimics what happens during and immediately after a vaginal birth. So many of the options like you have during your typical labor, your vaginal birth labor, options are available in unscheduled cesarean as well. So not just in a repeat scheduled cesarean, but in an unscheduled cesarean. Obviously, you should have a plan in place for a cesarean. Of course, you don't want one if you're planning a VBAC. You don't want a cesarean, but still creating a plan. That way, if something goes awry and it's medically necessary to have a cesarean, you can still have your wishes honored and you don't have to think of them in the heat of the moment because you already did all the work and wrote all of that down. So some of the options you could have is like a clear drape so that you can see the baby coming out, an extra support person, obviously your partner or You could have a doula or a birth photographer. You can make sure that your arms stay unrestrained and you can have them put like warm blankets on your arms. You can ask for no sedation, only numbing, because sometimes after they give you, like the baby's born, they just push sedation into your IV without asking. Happened to me multiple times. And I was like so alert and awake before that. And then after that, I was so loopy and just out of it. You can also make sure to request immediate skin to skin as long as you and your baby are stable, because that's definitely possible. You can literally pull your gown down and have your baby laying on your chest, if that's comfortable for you, right after your baby comes out. And you can ask them to delay the weighing and measuring. That way you can have that immediate skin to skin. You can also have music of your choice. You can have something playing in the background. Sometimes they'll be like, oh, it's if the anesthesiologist says it's okay. But no, I suggest that you advocate for having your own music if that situation arises. That way it can feel like you're in control because you should be in control, right? This is your birth experience still, even whether it's a vaginal birth or a cesarean birth, it's still your birth experience. And also, you could tell them you want to have immediate breastfeeding if you're able to be stable. So that skin to skin. Plus, you can breastfeed in the OR. I've seen it done. You can tell them that you want your baby to stay with you in the operating room and in recovery. Sometimes they separate you guys. I mean, unless it's like an emergency situation, I don't see why the baby would be taken out of the operating room. So definitely make sure you have your clear wants written out before. You could even have essential oils. You can have like a little essential oils or herbs. That way you can smell something calming. And then you can tell them, hey, no sidebar conversations. Like only talk about what is happening right now, like nothing else. Now, I want to give you some tips, and these are some tips for avoiding a cesarean. Okay. Now, this is whether it's your first baby or whether you've already had a cesarean and you're planning a VBAC. All right, so I want you to know your rights. You have the right to informed decision making. You have the right to have informed consent. And this means you were given an unbiased discussion on all of the benefits, all of the risks, and the alternatives of the proposed treatment or procedure. And you freely chose to consent. Now, you have the right to informed refusal. This means you were given an unbiased discussion on all of the benefits, risks, and alternatives of the proposed treatment or procedure, and you freely chose to refuse. You have that right, even if it goes against medical advice. Also, the use of like coercion is ethically impermissible, okay? But unfortunately, this is very common. Being bullied into a cesarean is ridiculously common. They will use things like your baby will die, or think about your baby. Like, don't you want a baby alive? And it's terrible because they cannot assure that each situation is going to turn out that way if you decide the opposite of what they're recommending. They have no idea of that. So it is your choice to accept or to refuse. You also have the right to change practitioners, literally, even on the day of your birth. Like if you are in labor and you do not like the doctor on call, ask for another one. You can ask for another OB, or if they have midwives available, ask for a midwife. You can literally ask for them to change, and they might say, well, we don't have anybody. Well, guess what? You can tell them now they can stay out of the room and the nurses can help you give birth to your baby if they don't want to be in the room. I'm not telling you to do that, obviously, but I'm just saying this is an option and this is actually something I've seen done. Okay, so you also have the right to revoke your consent at any time. So just because you give consent during the time that they're asking you, if you decide at that very moment they're going to do something like a vacuum or forceps, and you're like, no, 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 wait a minute, I changed my mind. You are allowed to do that anytime, literally at any moment. So consent forms from the hospital or your practitioner are not contracts. They are not. And they are not a replacement for a true informed consent discussion. So just because you signed the paper that they threw in front of you during labor, that means nothing. You can absolutely say, I'm revoking my consent. And if they do not listen to you, you can ask for the patient advocate if you're giving birth in the hospital. Because hospital policies are not laws. You're not going to get in trouble for going against a hospital policy. They might be annoyed with you in the hospital, but it's not a law. Like, you're not going to get in trouble. Ultimately, you get to decide what is best for you and your baby. So that is a tip number one. I know I went on a little tangent there, but knowing your rights. Okay. So tip number one for avoiding a cesarean is know your rights. Tip number two, educate yourself. Educate yourself on the stages of labor. Okay. Understand what your body is doing while you're in labor so that you can understand the process and you're not surprised when they're like, okay, you're in transition. Now it's time for da 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 da. When actually, it's whatever you want to do. You're not on their timeline. If you're in transition, do what you want to do. Look up transition and think about what things you want to do when you're in transition so that you're not coerced into doing something that you don't want to do. Also, I want you to make sure that you understand the common interventions that they're probably going to introduce if you're giving birth in the hospital. I mean, no matter where you're giving birth, because even if you're giving birth at home and you have a home birth midwife you've hired, you could still potentially be coerced into things that you don't want to do. So look into what they might try to coerce you into or what they might offer you as in interventions. Feel free to look up the risks and the benefits of each intervention so you can understand what you are saying yes to or what you are saying no to so that you can come back to them and say, no, I do not want Pitocin right now because I don't want to run the risk of da 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 da. Whatever it is. I'm just giving you an example. Also, educate yourself on the risk and benefits of having a repeat cesarean and having a VBAC so that you can understand what the risks and benefits truly are, like the true honest numbers. If you're a numbers person, look that up and realize what the risks and benefits actually are so that they can't say, well, you're having a VBAC, you're at a 50% risk of uterine rupture. Um, that's a lie. But I have heard doctors say that to clients that they have a 50% chance of rupture, which is like ridiculous. So just know the facts, know the risks and true benefits of what you are choosing to do. So that is tip number two, educate yourself. Tip number three, choose a practitioner who respects your birth preferences. Okay. No matter what those preferences are. And make sure that you feel comfortable and confident in their expertise because everybody practices so differently. Even if, say, you're going to a doctor's appointment and say the doctor's office, they have like, I don't know, 6 rotating OBs. Every single one of them, even though they're in the same office, they practice differently. Some might be okay with VBAC, some may not be. Okay, so making sure that you feel comfortable with them. And, you have different options. You can choose an OB, you can choose a midwife, even if you're planning to give birth in the hospital, you can absolutely choose. Some hospitals have midwives available. And I also want you to make sure that you understand just because you're going to see this one doctor throughout your whole pregnancy, that absolutely does not mean that they will be the one to, deliver your baby. Um, or they're going to help your baby out of you or be there to support you during your labor. Okay. Because it depends on who's on call. Sometimes OBs will special their clients. They will be on call specifically for that client if they request, as long as that OB is okay with doing that. Sometimes, not all the time. And sometimes, yeah, it does work out to where your OB is on call when you give birth, but you just never know, right? So that is tip number three. Choose a practitioner who respects your preferences. Now, number four, you can choose a midwife, choose midwifery, choose that midwife-led care, okay? And like I said, you might have the option of that in the hospital, depending on the hospital. Not all hospitals have a midwife available or even hire midwives. So be aware of that. But also, you can choose a home birth and you will be guaranteed a midwife. So if you choose the midwifery-led care, you are going to get such individualized care. Like in the home birth setting, oh my gosh, depending on the midwife, right? Because every midwife is going to be different, just like every OB is different. So typically with midwife-led care, you get appointments where they're like about, 30 minutes to an hour long. That whole chunk of time is yours to talk to your midwife. Think about that. A whole hour. That's compared to a 4 to 7 minute appointment with your OB in their office. And depending on the midwife, you either go to their office to have this appointment or they come to your house. I mean, that is care. And you don't have to worry about, oh my gosh, who's going to be on call for my birth? Because you know it's going to be your midwife. And a lot of times they have a bit backup midwife. So even if it's not that first midwife, they have a backup midwife. So you know it can be one of two people. I mean, that's so reassuring to me because I know how this person practices. They know what my preferences are and they're going to remember them because they've written them down. They've looked me in the eyes while they're talking to me and they've given me that one-to-one care that I wanted. And plus, hello, when you give birth, when you're in labor, you call them when you're like, every midwife's different, but you typically call them when you're like in active labor and they come to your house. They check you or don't check you. It's up to you. It's typically mother-led care. Obviously, make sure you're asking questions before you're in labor. Like, make sure you know how that midwife is, because some midwives do want to check you right when they get to your house. But if you want zero checks, make sure that you tell your midwife ahead of time. I don't want any cervical checks unless I request them, period. And they will honor that. That model of care is just so different than, obviously hospital care or OB care. Tip number 4, that is tip number 4. Choose midwife-led care. Obviously, it's a personal decision, okay? So it's up to you. Number 5, hire a doula. It is so incredibly nice to have a doula, and I speak obviously from personal experience. It's nice to know that you have somebody that is able to come to you and be your physical and emotional support person. They have possibly helped educate you before your birth. Like I said, every doula is different too. We all practice differently. Personally, I do birth education before. I do 3 prenatal appointments that last anywhere from 1 to 2 hours long each. So we get to know each other and I get to know the person on a one-to-one basis. I know what they like. I know what they don't like. I know how they want me to advocate for them because doulas can advocate for your preferences. Not all doulas do it, so make sure that you ask your doula before you hire them if that's something you really want. Obviously, they're that emotional and physical support. They can help you in that birth space to make you feel comfortable and maybe also help you not want that pain relief medication as quickly as you might have wanted it if you didn't have that support, right? Because we love husbands, but they don't always know what exactly they can do to help in that moment, especially because it can be hard seeing your loved one in pain and you just want to take away their pain. So that's why doulas can also help be that unbiased person in the room. That's, for one, if you're giving birth in the hospital, they're not connected to the hospital and their policies and regulations. Also, they're not as emotionally invested in you as the husband is. So that can really help bring this unbiased energy into the room that is literally there to give you the information you want, whether it's like evidence-based information or it's heart-led information, whatever it is you decide that you want, like that type of information. And I would suggest talking about that beforehand. So that can be super helpful. So tip number 5, hire a doula. If you're comfortable with having a doula in your space, anyways. Tip number 6, create your birth preferences. So I personally do this with my clients. We go over this in our first prenatal and we go about talking about every single birth preference, from pregnancy, when they want to go to the hospital, um, how they want me to support them in their labor, how they want me to advocate or not advocate for them in the hospital, how they want me to include their partner in this experience. Um, and just every single thing, where it goes from, do you want Pitocin? When do you want Pitocin? Do you want an epidural? When do you want an epidural? What's a code word you want to use if you do want an epidural? When do you want the cord to be clamped? Do you want to breastfeed? When do you want to breastfeed? Do you want to try colostrum harvesting? How long do you want me to stay afterwards? Do you want, the doctor to do this or not say this? We just go over everything. And I think that is so helpful because it helps you think about things you might not have thought about because, you know, you're probably working, you probably are taking care of your house and trying to lead most people lead a busy life, right? So you don't always have these things in the forefront of your brain. And sitting down and just thinking about your preferences that you want can really help not only just, the purpose of making this preference plan is not to put something in stone that, oh, this is going to happen. This is exactly how it's going to happen. No, it's to help you think deeper into what you do actually want. And that can actually trigger you remembering it when you're in labor. And I wouldn't even have to step in to advocate because you remember like, oh, this is the part where I wanted to advocate for myself because I don't want Pitocin. Just like I'm just giving you an example, obviously. So it's really important and it helps you dive deeper into what are the benefits of Pitocin, what are the risks of Pitocin, and just so you have that knowledge as well. And it's so helpful. And I don't want to I hate calling it a birth plan because then people feel like they failed if they don't go according to that plan. But no, it is just preferences that you want and it can change, and that's okay. So that is your tip. Tip number 6, creating a birth preference plan. And I hate that plan word, but preferences, is key. Tip number 7, practice those comfort measures beforehand. Like, don't just practice comfort measures when you're actually in labor, do it beforehand because if you start practicing it while you're pregnant, it is going to become second nature. So, like breathing exercises or relaxation techniques, whatever that may be, whether it's diaphragmatic breathing or it's getting in different positions, because if those positions or techniques feel more comfortable for you to do, you will naturally do them in labor without even consciously thinking about it. Because you don't want to be consciously remembering how to breathe diaphragmatic breaths. If it's second nature, you're just going to be like, and just do the breathing, right? So practice those comfort measures that you think you want to try in labor, do them in pregnancy. Tip number 8, don't just lay in bed, okay? When you're in labor, don't just lay down. Obviously, if you're tired, yes, sleep and rest, but even when you're laying in bed, switch positions. Go from your left side to your right side. Put pillows, create like a pillow nest so you can put some under your chest and be in a hands and knees position, but still resting. Even if you have an epidural, you can still move, okay? You can use a peanut ball to move. You can use a yoga ball. They even have something called a cub, which is like an inflatable thing that looks like a U. You can use that for different positions. I mean, there's so many different things. You can even, depending on how dense your epidural is, you can get in hands and knees. You can lean over the back of the bed. The bed is like a transformer. You can put, if you're in the hospital, the bed goes in so many different funky positions. You just ask your nurse or your doula who's experienced with the bed, and you can like break it down in so many different ways. Okay. So even if you have an epidural, you can still move. And I highly suggest you move. If you don't have an epidural, walking around, sitting on the toilet, getting in the shower, going from the rocking chair to the couch to the bed, just trying different things. If you have stairs, walking up and down the stairs, but don't like overdo it because then you're going to exhaust yourself. Like, do it every couple contractions or every hour or every 30 minutes, do what feels right to you. That's what I always suggest. But don't just stay in one position because then that's not going to really help your baby rotate in your pelvis, right? But obviously, if you feel the need to rest, do it. Yeah, because that could be your body telling you, like, we need to rest. So, tip number 8, don't just lay in bed. But if you do, there's your suggestions. Okay, so tip number 9, advocate for yourself. I know it's hard, especially if you're anything like me who's a recovering people pleaser. It can be hard to advocate for yourself. I always say get your partner or your doula on board to help advocate for you if you feel like you we don't know how labor is going to affect us. So you might think beforehand, I'm going to advocate for myself. I could do it. I always speak up for myself. But then you're in labor and you're trying to focus on getting through those contractions and you cannot advocate for yourself, you know? So have your husband on board, tell him like, hey, if I'm doing this or saying this, please advocate for me, or please tell them to like slow down, give us a minute to talk. Especially if they're asking you through contractions. Oh my God, that drives me nuts when they're like talking to you and you're having a contraction. It's like, please, let's wait till after this contraction and then let's talk to mom. Come on. So be prepared to ask questions, even in pregnancy. Make sure that you're expressing your preferences in pregnancy and in labor, okay? Listen to your gut feeling. Listen to everything that your body and your mind is telling you, because typically that is right. You know, whatever you're thinking is the right thing to do, whether they agree with it or not, right? And like I said before, even if they aren't agreeing with it, you can still always change practitioners. You can even change nurses. Say your nurse is just like having a bad day and she's giving it all to you. Ask for a different nurse. Ask for a different doctor. That is absolutely your right. I've seen it done time and time again. And then sometimes that next doctor or that next nurse is exactly what you needed, you know, because we're not going to get along with everybody, right? So sometimes the personalities just don't mesh. So you can absolutely ask for a different provider, practitioner. So that would be tip number 9. Advocate for yourself. You deserve to give birth the way you want, not just because they say they want you to give birth a certain way. Give birth the way you want. Tip number 10, the last tip. Prepare for the unexpected. So we already talked about making a cesarean birth plan, okay? Or preferences. So I want you to create those preferences just in case, you know, a cesarean does come medically necessary or you just decide that you want one. Have those preferences in place so that you can feel in control of what is happening and it can be on your terms, okay? I want you to try to stay open-minded and flexible. Even if you're not planning, or you know, if you haven't had a cesarean, if you're planning a vaginal birth, a vaginal birth might not play out exactly the way you envisioned, and that's okay. You just pivot, right? You be flexible and pivot. Because I feel like if we stay so stuck on exactly one thing happening the entire time, then it's absolutely not going to turn out that way. I think just being flexible and being like, okay, if my plan A doesn't go right, or my preference A doesn't go the way I wanted it to, here's my preference B. Here's my preference C. And it's okay. It's okay if we have to pivot, because I feel like if you're so stuck on one outcome, one way that it's going to play out, that can actually create birth trauma, which I know. It's hard to prepare for the unexpected, but there's so many unknowns in birth, right? We never know how it's going to unfold. There's so many factors that play into it, whether we're giving birth at home, at the birth center, in the hospital, who our doctor is, who our nurse is, who our doula is, how our partner's supporting us. Like there's so much that can happen. And so I just want to reiterate what those 10 tips I'm giving you to try to avoid a cesarean. So number 1, know your rights. Number 2, educate yourself. Number 3, choose your practitioner who respects your birth preferences. Number 4, choose midwife-led care. Number 5, hire a doula. Number 6, create birth preference plan. Number 7, practice comfort measures. Number 8, don't just lay in bed. Number 9, advocate for yourself. Number 10, prepare for the unexpected. Okay. I want you to go back. If I said all of them too fast, then I want you to go back and listen to it again and write them all down. Okay. I want you to take these tips because they can seriously help you. All right. You deserve more than just surviving this process. Okay. You deserve more. than just surviving this process. You deserve more than that. You don't have to just survive. You don't have to just have a healthy baby and that's all that matters. No, you matter too. Okay? What you go through matters. It's your body, right? So I will leave you at that. I really, really hope that this was helpful. And if you want to talk more about these tips or dive deeper into any of this with me, go ahead and send me a message on Instagram. I'm at Birthing Come True. And obviously, I'll leave the links down below so you can easily get to my page and send me a direct message. I'm so happy to talk with you. I hope you have the most beautiful day. Happy April. And I will see you in the next episode. Bye. Thank you so much for listening to another episode of the VBAC Junkie podcast. Make sure to leave a rating and subscribe to the show so that you don't miss an episode. And also, I have a free gift for you. If you would like to have a guide on how to prepare for a VBAC, head to my website at www.birthingcometrue.com/VBAC guide. And all of this will be in the show notes, so you can just click that link and head there and download this free guide. I hope you have an amazing week. Until next time, bye.